When it comes to your patient's MSK conditions, the skill of using tools is essential. When evidence and technology combine, we can end up with new treatment tools to help our patients get better faster. Over my career as a manual therapist, 3 tools have made their way into my daily practice. In fact, these are 3 tools that I'd never work without. Today, you're going to discover why these tools can make a world of difference to your clinical outcomes. So let's start with tool number 1, which is this tool, which I call the Impactor, is also known as a chiropractic adjusting tool. And there's also a trademarked version called the Activator, TAM. Now, I won't use the term activator because my solicitor and the Activator Method's legal department have advised me not to use their term. So this chiropractor has a chronic headache and he's had it for over 12 months despite all the treatments he's tried. As it so happens, he has to go to his dentist to have a big molar cavity filled. Now back in the 1950s, they used to fill these type of cavities with gold. So there he is, lying in the dental chair, and the dentist is packing the cavity with gold, and then the gold has to be hammered into place. And the dentist uses an instrument like this called an impactor. So he goes in and it's like bang, bang, and he impacts the gold in. And after the dentist has finished the job, chiropractor gets off the chair and then he notices that his headache's gone. What? Really? And this prompts him to investigate into how did that happen? And he comes to the conclusion that the force the dentist applied affected the nociceptors around his TMJ, resulting in the headache dissipating. Whoa! And that's how the Activator began, from a chiropractor researching what a dentist did. What a great example of cross-pollination between professions. Hey, what's crucial to know is this. Impactors do not hammer bones back into position. Rather, they tell the brain the desired effect, and then the brain activates the muscles to help out. It's a bit like when you're in a crowded cocktail party and there's people everywhere, you're looking around and then you feel someone tap you on the shoulder. You know how you get a bit of a start and you turn around? Well, that's what the Impactor does. The brain gets this rapid impulse and it goes, who's that? Or what's that? The Impactor does not hammer bones back into position. I think of the Impactor as being like the icing on the cake of my treatment. My manual therapies, like the mobilization, the manipulation, that's the cake. And then the Impactor is the stimulation to top it all off. It's like the icing. And that's why I wouldn't work without an Impactor, because it contributes to the most comprehensive manual therapy service I can provide. The second tool that I'd never work without is this precision instrument is brilliant at detecting and correcting fascial densities or irregularities in the fascial linings of muscles, ligaments, tendons. You know the term trigger points or pressure points? Well, this tool kind of works like a stylus on a vinyl record. It detects and amplifies any irregularities so that you, the practitioner, can feel any densities or restrictions that might be contributing to your patient's MSK conditions. So the great advantage of the TAM, or the tool-assisted massage, is that the tool amplifies those irregularities so that you can detect them with ease, even if your palpation skills are not particularly well developed. This tool speeds up your MSK assessments and treatments dramatically, and that's why I'd never work without it.